All right, so there's many different areas that are affected by an increase in technology in healthcare. So we'll just go through some of the common areas. So first, we're going to talk about early identification. The way that technology helps with early identification is really interesting. So one of the things that is big right now is the use of wearable devices to monitor health in real time. So this can be, people with pacemakers and their cardiologist is able to view that in real time, or as simple as people wearing their iWatch or their iPhone watch, and that will tell them their heart rate and everything. And that early identification can sometimes prompt people to go to the doctor sooner, which is really great. And then also for early identification, electronic health records can help diagnose based on algorithms and available data. So for instance, at one of my previous jobs that I first worked at, they had an algorithm for the early identification of sepsis. So if the nurse, let's say put in a high temperature and then also the patient was tachycardic, the electronic health record would notice if they also had a high white blood cell count among other factors, and then a notification would pop up that said, this patient is at high risk for sepsis, call the physician, and it would kind of give you an algorithm of like steps that you're supposed to take. So it's really great in just pairing together those factors and helping to identify different signs and symptoms early so that people can implement changes earlier on and improve patient outcomes. Another area is precision in surgery. So now there's robot assisted surgeries, even beyond laparoscopic surgeries. There are actual robots doing the surgeries, and these can lead to better results and faster recovery for patients, which is a win-win. And then another factor is patient care and nursing workflow. So we now have the electronic health record where you type in your like the data that you collect by your assessment, and this helps physicians to be able to see your assessment in real time, even if they're not in the same location, which is great. There's also handheld devices at the bedside. So an example of this would be glucometers. At the county facility that I work in, you obtain the blood sample right there at the bedside, and then when you dock that glucometer, the glucose level just goes automatically into the chart, again allowing for the physician to see it right away. There's also the implementation of telehealth, and this happened especially after COVID. Patients are now able to see their physicians on shorter notice because they could just do a video call, just like we're doing now. There's also electronic beds and lifts, which is great for nurses because this should help us reduce injuries. Um, and then electronic IV pumps, which make sure, that we are giving the correct dose and rate of IV medications.